and it's so good to be back. I had a wonderful vacation. I was away for almost 3 weeks, and I'm going to be sharing a little bit more with you guys about just the benefits of being away and having a break and being out in nature and hugging a tree and being with good people. And many of you have heard me talk about Aura Ring, and I'll show you the results on Aura Ring, how much all my different biomarkers have changed just being out in nature. It's pretty amazing. But today we're going to be talking about something slightly different. I feel like we are going to be talking about my past life, and I'm happy to call it my past life, and that's dealing with Graves' disease, dealing with Hashimoto's disease. But I know that for many of you, it's your current life. That's what you're dealing with right now. And so, as always, we're here to help you. I tend to talk a lot more about estrogen dominance, but I feel like it's equally important to talk about autoimmunity, because many of you who have Hashimoto's, you also have estrogen dominance. Many of you who have estrogen dominance also have Graves' disease, and they are very tightly correlated, and we can talk about that later as well. So come on, introduce yourself, and tell us about what is your journey, what has been your journey with Hashimoto's or Graves' disease, and what have you done so far to help yourself. So I got a guest speaker, Dr. Eric Osansky, and I'm going to introduce him in just a second. But before I do that, I want to just share with you the reason why we want to talk about is, because, like I said, so many of you here are suffering from Hashimoto's and Graves, but also, Alexandra, if we can pop out the banner on my journey. So my journey with Graves' disease started in my late 20s, so that's like over 20 years ago. And I remember, having, it started off with heart palpitations at night, really sweaty hands, going completely off rail when it came to just being triggered, getting really angry over nothing. I remember once we went for breakfast to this restaurant, the server brought a wrong thing, and I started yelling at him. And at that time, boyfriend looked at me like I was losing my mind, which I probably was. And then subsequently my hair started falling out. And so, I was one of the very, very few lucky ones who went to the doctor, and I got diagnosed with Graves' disease right away. Or I was diagnosed with hyperthyroidism, and then he tested for the antibodies. He diagnosed me with Graves. I got a big lecture from the doctor about how Graves works and what does it mean. But I was in my 20s. I didn't know any better. And I was put on some kind of thyroid suppressing medication, so that suppressed my thyroid, so the thyroid wasn't overproducing the thyroid hormone. And after that, I was kind of declared healed, right? Thank goodness he didn't keep me on the thyroid mats for too long. But with a vengeance, 7 years later, I, this time around, had the other side of the autoimmune condition, which is Hashimoto's disease. So this time around, the thyroid really starts to underperform. And so, and again, I was super lucky to be diagnosed pretty quickly. I was living in Shanghai in China at that time. And it wasn't surprising, because one of the things we're going to talk about today is really what can trigger an autoimmune disease. And surprisingly, how similar they are, even though they might be acting in a completely different way. One makes you hyperthyroid, the other one is hypothyroidism. But as you will discover today, the treatments and the approach can actually be somewhat similar, which is actually a wonderful thing. And I suspect that I actually had Graves and Hashimoto's at the same time when I was in Shanghai. I never tested for the antibodies, but looking at the symptoms, because I was going from being super active and super like jazzed up and like doing a lot of things and having like this bunny energy, to being not able to get out of bed. And so I think my thyroid was basically swinging between being hypo and being hyper. Anyway, so that's my story. Many of you I know are suffering from this, and I want to go over symptoms with Dr. Eric. And, Dr. Eric Osansky, let me just introduce him, bring him on. Hello there. Always good to see you.
Yes, good to see you, Magdalena. How are you doing today?
Very well, thank you. Just being out from a vacation, it just completely changes everything in your body, and it's just resets. So I feel wonderful. We always refer people to you for, like, whenever we get people asking about Graves' disease, the first thing we have that in our, SOPs, our standard operating procedures, is to refer everybody to you, to your website. You have a marvelous website called the naturalendocrinesolutions.com. If we can pop out that URL, and some of you might have seen Dr. Osansky. So, we're going to be talking today about Hashimoto's, Graves. We're going to be talking about some of the natural treatments and solutions that you can start looking at, point you to a couple of really good resources. The amazing thing is that there are so many great resources these days as compared to what it was 10 years ago. I don't know whether you agree with that. But in 2008, when I was diagnosed with Hashimoto's, and even prior to that, I didn't even try looking at anything. But in 2008, when I was diagnosed with Hashimoto's, there was literally nothing apart from one book that didn't really help me very much. So can I just do a quick introduction of you? So you are a chiropractic physician, which is interesting because I think in a lot of people's minds, it's like I go and see my chiropractor when I have a lower back problem or my shoulder is really tight, right? But it's really interesting because many chiropractors actually take upon themselves to go much further in the education, and I actually become very skillful functional practitioners. And so I want to just mention Dr. Osansky also has received Master's of Science degree in Human Nutrition and Functional Medicine from the University of Western States. He's a certified clinical nutritionist, certified nutrition specialist. He's also been trained by the Institute for Functional Medicine, IFM, which is a prestigious organization that certifies doctors in being functional. And he's not an herbalist, but he has received a certificate of herbal therapies from the Australian College of Phytotherapy. Very cool. And in your resources, I mean, your articles are some of my favorite resources to go to, just because you are so clear and so well researched and so holistic in the approach is really marvelous. Give us just a quick overview. I'm going to kind of dive into, stuff that we can start helping people with. But why don't we just dive in for a quick minute about how did you get to this point of wanting to work with Hashimoto's and Graves specifically?
Yeah, so I was actually one of those traditional chiropractors who really focused on neck and back pain and headaches. And then in 2008, I was diagnosed initially, like you, with hyperthyroidism and eventually with Graves' disease. And at that time, I wasn't too familiar with it, and definitely wasn't familiar with taking a natural approach. But that being said, just with my background, I really definitely wanted to avoid the more harsher conventional treatments, such as radioactive iodine, thyroid surgery, and actually opted not to take the anti-thyroid medication. So I took an herbal approach to manage the symptoms, and of course incorporated a lot of basics, diet, stress management, and the supplementation, did some testing to find certain imbalances. And I was able to get into remission, and I've been in remission since 2009. And that just, and I realized how many others deal with hyperthyroidism, Graves. And as you mentioned, there are a lot of similarities when it comes to treating Graves and Hashimoto. So I decided that I was going to focus on both hyperthyroidism as well as, hypothyroidism, Hashimoto's. Quite frankly, most of my practice these days is hyperthyroidism. I say probably like 80%.
Oh, really? Okay.
And that's probably because they have the affinity to me, just because I dealt with Graves' disease. So I wrote a book, Hashimoto's Triggers, in 2018, along with the book on hyperthyroidism in 2013. But like I said, most people see me for hyperthyroidism. And yeah, so I've been working with patients ever since I've been in remission, just helping people with, different types of hyperthyroid conditions, along with some people with Hashimoto's as well.
I'm just gonna very quickly share your page. For those of you, let me just enable this. So we have, in case you haven't seen the page, this is Dr. Eric Zielinski's page. And so the hypothyroidism and Graves' disease, great book. I have it at home too. Hashimoto's Trigger, that's your latest book, right?
Correct.
Yeah. Okay, cool. So in all of that you can find on naturalendocrinesolutions.com. All right, what I would love to talk to you about first, actually, let's establish first and foremost, how do we know whether somebody is hypothyroid, hyperthyroid? Because actually I would love for you to go over the symptoms, because there's also some overlaps of both of them, and which can be very confusing to some people. And then I want to talk about the fact, maybe I'll just say it right up front, that you can actually be both hypo and hyper at the same time, which can be even more confusing for folks. So let's talk a little bit about that. Why don't we go over this list of symptoms so that, and for those of you who are listening live, or if you're doing this on replay, do tag friends who suffer from those on a regular and chronic basis, because I have found that thyroid problems are one of the most underdiagnosed, misdiagnosed conditions in the country. Somebody is depressed, and so they're put on antidepressants, they put on weight, they are told to eat less and exercise more, right? They have anxiety, they're put on anti-anxiety meds, et cetera, not addressing the root cause of the problem. And, and very often it is the thyroid. So let's go over the symptoms.
Sure. So symptoms of hyperthyroidism, including Graves, some of the more common symptoms: increased resting heart rate, heart palpitations. Some people experience tremors. Yeah, so same here. So I experienced all these that I'm mentioning. Weight loss. So when I dealt with Graves, I lost, I don't know about you, not everybody loses weight, but I lost 42 pounds. So I lost a lot of weight.
So I just want to share, so I didn't, but then there are people who also have Graves, and I've worked with women who had Graves and they actually put on weight.
Yeah,
so
I
that's
see that
one
too.
of the confusing symptoms I find. Yeah.
Yep. Increased appetite is common, just with the increased metabolic rate. Sometimes loose stools. For Graves specifically, some people have eye symptoms, what's called thyroid eye disease. And so they could have, pressure in the eyes, swelling, sometimes bulging. When it gets more severe, double vision. And so that's, a good number of people. And a small percentage with Hashimoto's actually have thyroid eye disease, but of course it's more commonly associated with Graves' disease. And I mean, those are some of the more common symptoms. Anxiety.
I had anxiety. Yeah. Anxiety was a huge one. I also felt like I was going in 1,000 miles an hour, kind of a thing. Like my brain I was unable to focus. I was almost like, it was like a, ADD, ADHD sort of thing where you're just like so rattled up, and I felt like my mood, like I was describing, yelling at a waiter for bringing the wrong thing. Actually, after that, I went to see a doctor because I knew something was really off. Like this wasn't normal behavior. Okay. What about hypothyroidism?
So with low thyroid, some of the more common symptoms include fatigue, weight gain. Now hair, I didn't mention hair with hyperthyroidism. A lot of people with hyperthyroidism lose hair. That could also happen with hypothyroidism as well. So some people don't lose hair, but it's just more dry and brittle. And same thing with the skin, hypothyroidism, a lot of time dryness, but I also work with a lot of hyperthyroid patients who experience dryness, brain fog, and constipation is, coldness, so cold hands and feet. And, so those are some, I mean, there could be many other digestive problems. Again, I wouldn't say those are classic symptoms. You could have that both with Graves, Hashimoto's, but the ones I mentioned are some of the more common symptoms associated.
I also find depression to be very rampant, but again, not exclusively related to thyroid. And the fatigue that Dr. Eric is talking about is, I just want to say, it's different from a fatigue that you feel like at the end of the day when you're just healthily tired and you're ready for bed. It's the kind of fatigue that if you don't have 3 cups of coffee, you ain't gonna get out of bed. And it's like feeling completely empty, and as if something sucked all the energy out of you. It's a different kind of fatigue. Weight gain is an interesting one too with thyroid conditions, I find, is because like one way you know that this potentially could be thyroid is when you have not changed anything else in your life. Your stress level is the same, your food is the same, your exercise routine is the same, and you just suddenly go 20 pounds more, and it's like there's no good rhyme or reason why that happens. So something to look at.
Yeah.
How do you? Let's talk a little bit about. We're going to talk about treatments in just a second, but I want to just also set up the stage for it that there is an overlap of treating Hashimoto's and Graves. Can you just maybe explain that, why the treatments aren't all that completely different?
Well, sure. So most cases of hyperthyroidism as well as hypothyroidism are autoimmune. So 90% of people with hypothyroidism have Hashimoto's, and approximately 90% of hyperthyroidism people with hyperthyroidism have Graves' disease. So what they have in common, they're both more immune system conditions rather than thyroid conditions. And when you're dealing with immune system conditions, the goal is to try to find triggers, underlying imbalances, heal the gut. So there definitely is a lot in common. Where it differs is the symptom management aspect of hyperthyroidism compared to hypothyroidism.
So let's talk about the baseline solutions. Like when you look at someone who's got Graves and Hashimoto's, the similarity of those treatments, like what do you typically start off with in your practice?
Well, like most practitioners or most natural healthcare practitioners, most endocrinologists pretty much just give a prescription and that's it. But most natural healthcare practitioners, functional medicine practitioners, start with diet. That's an excellent place to start. And there's no perfect diet for everyone. I mean, I do like autoimmune paleo as a starting point. And I can't say 100% of my patients go on, autoimmune protocol. But I think the most important thing is just to eat whole, healthy foods, good variety of vegetables, and try to eat organic whenever you can. Of course, trying to avoid the refined food, sugars, unhealthy oils. So diet is, I would say, probably number one. And, followed by stress management. A lot of people know that they need to change their diet, but I think a lot of people overestimate their stress handling skills as well as underestimate their stress levels. And that included me when I was dealing with Graves. I knew that I had to clean up my diet, but I was in denial when it came to stress. I thought that I was a master when it came to handling stress. And then I saw my adrenals. I had adrenal saliva testing, and my cortisol levels were depressed. My DHEA was depressed. Pretty much everything was low. And that made me realize that my adrenals aren't in a great state of health. And I've seen that over and over again with my patients as well.
What did you do to fix to address your stress levels?
Well, there's only so much you could do when it comes to reducing stress levels. I mean, so if someone is dealing with a lot of stress in their life, of course, try everything you can to reduce stress levels. But in my case, and in many people's cases, I was doing things to try to improve stress handling, meditation, deep breathing. Over the years, I've been using, you're probably familiar with HeartMath, which is a type of biofeedback, measures what's called heart rate variability. And, really a way just using technology, just kind of combining meditation technology, just again, a kind of type of biofeedback. And, of course, making sure I got proper sleep. And I did take some herbs, and the herbs I took, I had like low cortisol levels. So I took licorice root, which people want to be careful about just because it can raise blood pressure. So, and with your background, certain herbs, are, again, I'm going to be biased and I'm going to recommend you should always be, working with someone, but that's one you probably really should be under the guidance of someone.
Yeah.
So licorice root, I did take some adaptogenic herbs. In my case, Siberian ginseng, which is also known as eleuthero. Of course, nutrients. We don't have even though I took adaptogenic herbs, we don't have a deficiency in ashwagandha or eleuthero, but when you're stressed out, you tend to be lower in the B vitamins, vitamin C, and and diet, of course, comes into play. That plays a big role. So even though I took supplements, you want to make sure, again, to just going back to diet, you want to do everything you can from a diet perspective. Supplements is as the name suggests, you're just supplementing the diet. It's not a replacement for the diet.
Mm-hmm. Yeah. It's funny you mentioned HRV and HeartMath. So I don't do HeartMath, but I do measure my HRV through my Oura ring. And it was really interesting. For those of you who are not familiar, I'm going to talk a little bit more about it in the coming weeks when we're going to be talking about better quality sleep. But heart rate variability is a measurement that is really used often now to look at your function of your sympathetic and parasympathetic nervous system, and just the restfulness and the balance that your body is in at a given time. And you might be feeling like, oh, I'm feeling relaxed, but your nervous system might be actually feeling something different. So HRV is a really great marker for that. And just to let you know, Eric, during my the vacation that I was on, which is a botanical camp that I went on for 2 weeks, out camping, being in nature with good people, good food, lots of herbs. And my HRV went from an average of 21, that was before I left on a camp. And it wasn't particularly stressful time. It was just, that was my baseline. It went up to 39. So it doubled in, as compared to what it was before. So pretty amazing. Not in the first 3 days. So there was almost like, we always say the first 3 days for your vacation is to like really unwind. And so definitely I could see that on the HRV. It's only after that, in the first week, that I managed to get up to 39, and after that, my battery died, and that was the end of measuring. So, all right, we've got a question here from Alexandra. My saliva cortisol levels are sometimes higher and sometimes lower. Is it due to switching back and forth from hyper to Hashimoto states?
Okay, so let's see. My saliva cortisol sometimes higher, sometimes lower. I mean, it could be. It's not. The thing is it's not as if people with hyperthyroidism always have, let's say, elevated cortisol levels. Because again, I had low cortisol levels, and similarly, it's not like people with Hashimoto's will have. So it's not necessarily dependent on the pattern, on the thyroid condition. Usually, it's dependent on the stress, and that's the downside of any cortisol testing, not just saliva, but in a lab. So if you get a blood test for cortisol, so cortisol responds to stress. So if I measure cortisol levels in a patient, and if I see the morning cortisol, let's say very high, I'll just also check in with the patient, make sure that day it wasn't very stressful. The morning they collected a sample, because you can get a false elevation of cortisol, and that's more common than a false depression. Although certain medications such as corticosteroids, even I've seen people use skin cream where, like with steroids, and it depresses cortisol. So you need to be careful. And usually when you're doing saliva tests, it'll ask you when you're filling out the forms, as far as if you're using any creams. But as far as the stress, they're not going to mention. Just make sure it's not an abnormally stressful morning or stressful day. I had one person, I remember this, one saliva test where, I do, with saliva testing, you're looking at cortisol levels throughout the day. So and it's important to mention that. Whereas if you get a blood test, they're just looking at a single sample of cortisol. And there was one person I remember where cortisol was sky high in the middle of the day around lunchtime. And so I asked her, was it stressful? And she happened to be studying for a test right around that time, right around the time she collected that second sample. So again, that's just another demonstration of how things can artificially elevate cortisol. So I still think it's a great test. Saliva testing, also dried urine testing, Dutch testing is another option that looks at circadian rhythm. But you just need to be aware that there are factors that could affect the cortisol levels.
Yeah. And let's talk a little bit about your favorite methods of improving gastrointestinal health in Hashimoto's and Graves patients.
Sure. So again, diet is important. So you want to eat healthy diet. And I mentioned earlier, I think variety also. So it's when it comes to feeding the gut flora, the just supporting the gut microbiome. We hear about probiotics and prebiotics. So prebiotics are what feed the bacteria, and probiotics are actually the bacteria. So you want to do as much, again, through diet and, like probiotic foods, fermented foods, sauerkraut, kimchi, fermented pickles, and then, kombucha is another one. And then prebiotics, try to get through fiber-rich foods, and vegetables are very important. So I don't know if you're familiar with Dr. Jason Horlick, but he's
I'm not. Tell us more about that.
Yeah, he has a website, Probiotic Advisor. He was actually my instructor when I went through my master's in nutrition, and just brilliant when it comes to probiotics, does a lot of research. And so, but more recently, for what I attended a conference a few years ago, online conference, and he was talking a lot about prebiotics, more about prebiotics and probiotics, and these days we see the opposite, people just taking probiotic supplements, and I do recommend probiotic supplements, but he was again focusing a lot on prebiotics, a lot on variety. So he mentioned that most people should be eating 40 different types of vegetables per week, which is difficult to do. And I can't say I do that, but I would say if I had to take a guess, probably the average person, maybe 5, maybe not even that, as far as different types, because people tend to eat the same foods over and over again. So they might have a salad every day just with 1 or 2 greens, and maybe they have a smoothie every day, but it's again the same thing that they're adding. So I would say to at least maybe 40 might be a little bit out of reach for many people, but maybe aim for 10 to 15 or even 20 like different veggies per week.
Are there any specific vegetables that you recommend to because we're talking about prebiotics here, so are you talking about vegetables that act as prebiotics?
Yeah, I mean, I would say, so for example, broccoli will be more beneficial for the gut flora than like romaine lettuce, just because there's not going to be as much fiber. So eating more fiber-rich vegetables, cruciferous vegetables, asparagus, really good. But that doesn't mean that you can't add, things like lettuces and arugula. So those will still feed, the good bacteria, just more of the fiber-rich, vegetables I would make sure you're getting on a daily basis.
Mm-hmm. Okay. So what else on the gastrointestinal health?
Yeah, so there's something which I'm sure you're familiar with, the 5R protocol. Some will call it the 4R protocol. So the 5R protocol. So we got remove, replace, reinoculate, repair, and then rebalance. So the probiotics fall under the reinoculate, and then the replace is replacing things such as digestive enzymes. A lot of people are low in stomach acid, so they might need to take something like betaine HCl, or maybe they just take apple cider vinegar to stimulate their own body's production of stomach acid. Repair things, drinking bone broth or cabbage juice if you're a vegan vegetarian. There's also L-glutamine as well. And then rebalance. Just don't want to get into too much detail about the parasympathetic nervous system and the vagus nerve, but and that also ties into stress, mind-body medicine. But notice I skipped over the first R, and that's what a lot of people do, which is the remove part. So a lot of people I see, taking the probiotics, taking the digestive enzymes, taking the L-glutamine, and but what's causing the gut dysbiosis, the imbalance in the gut flora, the leaky gut? Is it gluten? Is it dairy? Are you not eating organic and maybe getting too much glyphosate, which has been shown to disrupt the gut microbiome? There's a time and place for antibiotics and proton pump inhibitors, but they could also have negative effects, of course. Antibiotics, everybody knows, on the gut microbiome. So you want to try to do everything you can to remove or at least minimize factors that's disrupting and putting stress on the gut microbiome. So again, those are really just trying to, and I usually accomplish, diet-wise, of course, I'll just tell people to eliminate gluten, eliminate dairy, eliminate corn. But when it comes to like gut infections, if someone has a gut infection, typically I'll recommend testing, whether it's a comprehensive stool panel or a different type of test. And so I do everything with the 5R protocol, and you could do things at the same time. It's not like you have to remove and then rebalance and repair and reinoculate and replace. But if you do the last 4 and you skip over that first one, then you're really not going to be able to effectively heal your gut.
Yeah, I'm so glad you mentioned infections, because I have found that a lot of people, when the diet doesn't work, it can be very frustrating because somebody embarks on, say, AIP and the paleo for autoimmunity, right? And which is a pretty restricted diet, and especially if you want to go out and eat. And then, the Hashimoto's antibodies still aren't coming down, or Graves antibodies are not coming down, and the person is still highly symptomatic. It can be very frustrating, right? And so I'm glad you really mentioned that, because that's what I have found, that when our gut health isn't improving, symptoms are not going away from autoimmunity, is really worthwhile investing in testing, working with a functional practitioner like Dr. Eric to get things tested properly. And then all sorts of stuff starts coming out, like parasitic infections. It can be a bacterial infection. It can be SIBO. It can be so many other things. And without addressing those, it's very hard to move forward. We have a really good question from Jodi, because I think it creates a sense of nuance to our conversation. Jodi is saying, what do you recommend for someone who has candida and oxalate issues when trying to eat pre- and probiotic foods like fermented foods? Certain greens cause issues for oxalate dumping, ferments cause itching, etc. So I suspect here with ferments are causing itching, I think she's also talking here about potentially histamine problems. And this is a lot, a fraction, it's not even a fraction, a big part of our community is actually women who have done the baseline, that we are talking about. And they go like, how then do you modify it when I can't drink bone broth because I've got histamine problems? How do I do those green vegetables when, for example, beets are so great, but then I can't do beets because they're so super high on oxalates? How do you, from your experience, how do you deal with those anomalies? But, it's a pretty common anomaly, unfortunately, these days.
Yeah, it is challenging when trying to, incorporate some of these foods. And I mean, the oxalates, so you're not going to eliminate all of the oxalates. I tested, I did urinary testing for oxalates, did organic acids test and was high in oxalates. And again, I think in my case, it was from adding too much spinach to my smoothies. And so that was the main, and obviously everybody's different. There's, sweet potatoes and, other foods that are higher, nuts. I mean, there's plenty of high
Chocolate,
oxalate foods.
cacao.
Yeah, exactly.
Mm-hmm.
But again, I in my case, I just I cut out the spinach completely and reduced the nuts because, as a snack food, I must admit that, especially in the past, would rely a lot more on nuts. And even now I do have some, but those are the main two changes. I can't, and I mean, if someone's eating, a large sweet potato every day, then maybe, again, either cut it out or reduce it to small. So like I said, you're not going to completely get rid of the oxalates. And, oxalates and candida kind of go hand in hand as well, because candida, so it's not just the food that can cause oxalates, but again, yeast. And that's why, certain organic acids tests, like the one from Great Plains, looks at yeast, looks at oxalates, and because again, and mold too, not just candida, but different types of fungi, can also produce oxalates. So really, in this situation, I would definitely focus, again, this is where the remove. So, removing maybe a little bit of the oxalates from a food perspective, but I would focus more on the candida, and of course, candida, you want to try to do as much through diet, although sometimes you might need to take, whether it's herbal antifungals or prescriptions such as nystatin or diflucan. But again, I would focus more on the candida, because that could be also a big factor when it comes to the oxalates. And that also could be a factor with histamine. When we talk about histamine intolerance, that also, relates to the gut and gut dysbiosis, and candida falls under that category. Magdalena mentioned SIBO, which might not be a factor with you, but that's also something to potentially consider.
So I just want to share, I've had issues with oxalates that became so bad that when I was writing my first cookbook and I was testing recipes that contain, for example, cacao, which is extremely high in oxalates, I will put it in my mouth to sample it, like looking, texture, feel, flavor, of course, and I couldn't swallow it. I had to spit it out because I was getting such severe pain from oxalates that it was a shooting pain, like as if somebody was stabbing me with a knife, especially in my legs. That was my issue. And everybody has got different set of issues with oxalates. But, and then of course, like everyone else, you start researching on what to do to address this, right? And there's quite a number of different forums online on how to address it. And many of them focus only on the removal and then adding a little bit of supplements to degrade oxalate in the foods. But generally the direction is stay away. They demonize oxalates like it was such the worst thing on earth. They will say things like, Whole Foods has a bag that's got these like words like cacao, chocolate, almonds, and all that, and then the conclusion was, oh my God, Whole Foods is trying to kill us, with oxalates. It's just like the kind of obsessive behavior. I had a challenge with that, and I told myself, my logic was that if I could eat chocolate 10 years ago, 5 years ago, did not have a problem. And it's only after taking an antibiotic that I really wish that I didn't. And that messed up my gut. And then I developed all these problems with oxalate that clearly it's my body's inability to break down those oxalates, to degrade them, right? And eliminate them. And that was my focus. And so anybody who's got problems with oxalates, and same thing with histamine, you want to go more upstream. Instead of avoiding them, yes, you need to probably minimize them and as a temporary solution. But if you really focus going more upstream and figure out and work with somebody to help you eliminate infections, reduce stress, populate the gut, just repair your gut. I mean, it's really, the simple term is fix your gut. Although this can be a complex issue for some people, it can take a couple of years even. But then you start realizing that the number of foods you can eat is much wider. You are not driving yourself crazy. You're not, one of those people who goes out with a bunch of friends, and now that things are kind of opening up, it'll be like, oh, I'm just gonna have a piece of chicken and a zucchini because that's all I can eat on my list, which can be super, limiting. So, Jodi, great question. I'm glad that you asked it, and the answer is to go much more upstream. And I agree with you on candida as well. When I addressed my candida too, my tolerance for oxalates have reduced. And so much so, you guys, just to let you know, I can eat totally normal levels of oxalates, not overdoing it. I would never eat like a whole, more than probably 3 squares of chocolate, because that's like one of the highest foods in oxalate. That's probably my limit. I don't know whether it's a PTSD from oxalates or whether it's some kind of a common sense, but my body is like, okay, enough. But I have zero pain today, and that's completely not an issue anymore. But again, I just did it by fixing my gut and working with somebody on that. Okay, let's, and for those of you who are tuning in, we're talking about Hashimoto's and Graves' disease and ways of dealing in that. I'm talking to a great practitioner, Dr. Eric Osansky, who specializes in this area, and he still does consultations. So many of you always email us asking about whether I do consults. I don't, I'm not able to, but that's why we have practitioners like Dr. Eric who does, and he can work with you. Let's, I would love to, so for those of you who are listening live, just pop us, tell us what are your questions, what would you like to know, but also if you want to share with us what has been your journey, what have you done that has helped you with Graves and Hashimoto's, we would love to hear from you. Or maybe where are you stuck? Tell us on that too. So let's talk a little bit about mistakes that people make when they have an autoimmune condition, because I think this is like the kind of information sometimes, when I looked at your points, and I'm like, oh yeah, I wish I had known this, 12 years ago when I was first diagnosed in 2008, 13 years now. So, the first one that I think you mentioned, let me just pop this out, was, Alexandra did it. Okay, covering up symptoms with medicine and not getting to the root cause. Can you elaborate on that?
Yeah, and let me also say that a lot of my patients take medication. So a lot of my hyperthyroid patients take anti-thyroid medication, and a lot of my Hashimoto's patients take thyroid hormone replacements. So which arguably one could say that's not a medication because it's more of a replacement. But either way, I'm not opposed to people taking medication. So there's two parts to this. So again, covering up symptoms with medication and not getting to the root cause. So if someone's taking the medication and addressing the root cause, I think that's perfectly fine. I have people all the time that's doing that, doing both, which you want to be safe. So yeah, but for those who are just taking a medication, which unfortunately describes most people with these conditions, because they'll go to the endocrinologist, and if you have Hashimoto's, they're just given a prescription typically for levothyroxine. And if you have Graves' disease, you're either told to, take anti-thyroid medication or to just go and get radioactive iodine or thyroid surgery. So of course, most conventional medical doctors aren't going to going to advise their patients to get to the root cause, but doing both is perfectly fine.
Let's look at mistake number 2. Believing everything your endocrinologist tells you about treating autoimmune thyroid condition. Before you dive in, I just want to mention, I remember when I was in private practice, and I started out when I lived in New York, in Brooklyn, and I had a woman come in and she's like, this diet thing, I'm told her daughter signed her up, on my program, and so she came to visit, and she said, I'm considering this diet thing since my daughter signed me up for it, but I'm seeing the top dog in the endocrinology department in one of the Ivy League schools in New York. So it's kind of easy to figure out which one. And then she came back 3 weeks later, and she's like, all he did was upped my meds. And of course the symptoms weren't going anywhere. So she was much more open to working with diet changes. I'll never forget this, because he was a top dog. So she had these amazing expectations of top endocrinologists in the country. That didn't go very far.
Yeah, and it's unfortunate because, again, most endocrinologists, won't do that. They'll treat the thyroid, even though, again, Graves and Hashimoto's are immune system conditions. And if you ask them, well, what are you going to do for my immune system? They'll pretty much say there's nothing that could be done. You just got to take this thyroid hormone replacement, or in the case of Graves, take the medication. And maybe if you take the medication in the case of Graves, you might go into remission, which, the thyroid hormone levels might normalize, but almost always the person relapses because the cause of the problem wasn't addressed. And then the next time they'll be pressured even more to get radioactive iodine thyroid surgery. And yeah, if you bring up diet, how about diet changes? They'll completely dismiss diet. They'll completely dismiss anything related to the gut. So yeah, just
which is really, that in itself is it fascinates me always that, doctors go to school for almost 10 years and have, hundreds of thousands of dollars in debt in their schooling. And if you just go to PubMed and you enter gluten and Hashimoto's or autoimmunity and antibodies, there's a body of research that comes out. So that itself is interesting. Let's look at mistake number 3. Thinking there is no hope in restoring your health.
Yeah, well, it seems for a lot of people far-fetched, especially after they speak with their endocrinologist who tells them that there's nothing that could be done. But I think also people might, especially in this day and age with social media, they might see others in Facebook groups or, Instagram or other platforms, other groups that they're in, where they see people who get awesome results taking a natural treatment approach, but they have doubts they don't think they could do it. They, whether they think that the diet might be too hard to follow, or, that, they have too much stress in their life and there's just nothing that could be done. And I'll say diet wise, I grew up eating no vegetables. Everything you shouldn't eat is what I ate growing up. And I was definitely better after graduating from chiropractic school. So when I was diagnosed with Graves, it wasn't as bad as growing up, but I still, even in chiropractic school, they teach nutrition, but a lot of chiropractors still don't eat optimal. And I was better than probably the average person, but I still, was eating still more junk than I like to admit. And I had doubts too. When I dealt with Graves back in 2008, I was the only one at that time I knew who had Graves and who was trying to get into, remission. So I was skeptical as well, but I was just thinking about the alternatives. And same thing if you have, let me backtrack. If you have Graves, there's a good chance if you don't do anything, you might end up getting the radioactive iodine thyroid surgery. But even if you have Hashimoto's, if you don't do anything, you'll just have the medication increase over time, the thyroid hormone replacement increased over time. But another factor you need to consider is that someone with one autoimmune condition will have a greater risk of developing multiple autoimmune conditions in the future. Not that it's guaranteed, but still much greater risk. So that's another thing. So even if so the goal is not just to get into remission and just to, restore your health, but just to prevent other conditions from developing. And, there's almost always hope. It's just, some cases are more challenging than others without question, but, again, you might have to work with the right practitioner and that's the thing too. You might see one or two practitioners and maybe they're not, maybe they're, new out of school, or even if they've been in practice for 10 years, they might just be doing the same thing over and over again and might not be able to handle more complex cases. But without question, I think there's hope for everyone. Just some cases are more challenging than others.
Yeah. And also, just since you're talking about meds, I have found that I've never been on meds, thank goodness, and managed to avoid that completely. But I've worked with so many women when I was in private practice. And the thing with medications is that you come to a point where they just stop working. And the more the endocrinologist puts you on, for some people, for some women, that you just stop, women just stop responding. And unless you make some other changes. Let's look at mistake number 4. Not considering a natural treatment approach. So, I mean, I guess that's the whole thing that we were talking about here.
That's most people, of course. Most people who see a, conventional medical doctor or endocrinologist, and they're diagnosed with hyperthyroidism, hypothyroidism, Hashimoto's, Graves. Most people are not considering a natural treatment approach, and some people are just not aware that that's an option. But some people might come across my website or someone else's website or hear a podcast and just still not consider it. Just be skeptical and just say, I'm just going to follow the doctor. Or they might think it's too hard. Again, it's just easier to take the levothyroxine, or even desiccated thyroid, or just to take the, or even get radioactive iodine. There's some people that, I don't want to go through a natural treatment approach. Just give me the radioactive iodine, and then I'll take thyroid hormone replacements, and and that's the perspective. I suspect most of the people who are here are not gonna be in that group. All right, let's look at mistake number 5: being closed-minded. And again, this kind of relates to just, again, you want to be open-minded. And again, that this probably doesn't relate to those people in this group. The people in your group are going to be open-minded, just like the, my patients and the people in my Facebook group. But yeah, just too many people. And it's not just, again, it's not just the patients dealing with Hashimoto's and Graves, but family members who might be closed-minded and might try to talk you out of taking a natural approach. That's a big issue too. They just, and my parents definitely had a medical mindset. I grew up, taking antibiotics, I would say frequently. I'm not like every week or every month, but again, just just closed-minded. The doctors, your friends, family, but yeah, of course, the patient. A lot of people just with Graves, Hashimoto's are not open-minded when it comes to a natural treatment approach.
This is a great story from Laura. She says, "Thanks, Magdalena. I discovered to have Hashimoto's. My TSH was 3.67. The endocrinologist put me on thyroxine, but after 2 months, I started to develop side effects. I threw the medication and started eating organic and dairy-free. 3 months on the diet, my TSH went down to 2.06, and which is a good thing, just in case you're not familiar with this. And lots of symptoms subsided. I'm with a functional doctor to put my antibodies into remission." Absolutely great
Awesome.
story. Thank you, Laura, for sharing. Sanja is asking, what does it mean when you have Hashimoto's but your thyroid function is normal?
Yeah. So there's what's called the autoimmunity timeline, and so it takes years for, especially with Hashimoto's. Really all autoimmune conditions. With Graves, with Hashimoto's, with all autoimmune conditions, you're going to get antibodies developed before they affect the numbers. So in the case of Hashimoto's, for years you could have elevated anti-thyroid globulin antibodies or TPO antibodies, yet TSH looks good, free T3 looks good, free T4 looks good. And then over time, what happens is they start slowly getting out of range, and they might, also there's optimal range versus lab reference range. So they might be within the lab reference range. And that actually describes a lot of people with Hashimoto's. TSH, in the case of 3.67 with Laura, that's within most lab ranges, but it's greater than optimal. So optimal, I would say, between 1 and 2, some will say between 1 and 2.5, 1 and 1.5. So again, it could take 10, 15 years for enough damage to take place to the thyroid gland where you have overt hypothyroidism or even subclinical hypothyroidism, which again, maybe a TSH of 3 or 4, but thyroid hormone levels are within the lab range. And so in this case, thyroid function is, at least appears normal on a lab test, but you still have that autoimmune response. And many cases, just a matter of time before, again, enough damage takes place to the thyroid gland. So unfortunately, most medical doctors would just say, oh, don't worry about it, let's just wait. And then when you're there, when it's showing an elevated TSH, we'll just put you on thyroid hormone. But of course, Magdalena and myself will teach you to, take action now, try, improve do everything you can to improve your immune system health, improve your gut health, your adrenal health. Just don't wait until your thyroid levels are outside of the reference range.
Yeah, totally. And I just want to build on this as well to consider one more thing is to use your labs as an indicator of things, but this is not your holy grail of how you're feeling, because at the end of the day, your symptoms are very, very telling. So if you spend some time on my website, on my About page, I'm very transparent with my labs. Since in 2008, when I had my labs done, I had Hashimoto's very elevated TPO antibodies, but my TSH and T3 and T4 were all within range. So that means I probably caught it in an early stage. However, I was already displaying a lot of the symptoms that I talked about at the beginning of this video, right? So having anxiety attacks, having sleeplessness, having swollen limbs, having there was a lot of estrogen dominance overlap there, but depression, getting into depression, and started having a lot of hair loss. My nails were breaking, right? So a lot of these symptoms, but hey, my thyroid numbers were looking pretty good, right? So if you just look at a TSH and all that. So Sanja, I think will be really wise for you to tune into your symptoms and not just rely on labs for indication of your thyroid health. All right. Yeah. So let's show folks where they can find you. And you got a very, very informative website, you guys. It's if you want to DIY it, Dr. Eric's stuff is really, really great. If you want to work with him, he's still doing private consultations and group consultations. I think you have groups, right, that you conduct.
Well, what I have a program which includes not only one-on-one calls, but also has a group aspect to it as well.
Mm-hmm. And also I think before we go, I just want to address one more because there's not a really good question here that just came in about iodine. I want to address this before we wrap up, Eric, if that's okay with you. Take iodine or don't take iodine. If you have Hashis, everything I read says it's important for thyroid function, but I literally have horrible reactions to iodine. Great question.
Yeah, so this is definitely controversial. So,
Mm-hmm.
and again, we could spend a whole nother Facebook Live on this, but so with iodine, so you are correct. So iodine is important for thyroid hormone formation. And some practitioners will say take iodine, some will not say won't take iodine. So now when what's interesting, I dealt with Graves' disease and not Hashimoto's, but still, whether it's Graves, Hashimoto's, a lot of practitioners will say, take high dose iodine. And I did in the past. I have experience taking high dose iodine and I did okay with it. But that doesn't mean everybody. I learned over the years, that iodine in some cases can cause a lot of oxidative stress and cause things to be worse. So what I would say is, first of all, again, I would work with a natural healthcare practitioner, but I would say I would be cautious about taking iodine. If someone takes iodine, there's testing. The testing's not perfect, but I would recommend like urinary iodine testing over blood testing. But even if someone has a deficiency on a urine test, they still might have problems with iodine. And it's, again, some will say never take iodine. I don't know if I agree with that. If you have a deficiency, maybe eventually you need to correct that. But I would just be, cautious about taking iodine because in the case of Hashimoto's, it's in all likelihood not an iodine deficiency. Remember, it's more immune problem. So when they talk about iodine and thyroid, again, yeah, if you're really deficient in iodine, you could be hypothyroid. But for those with Hashimoto's, their thyroid hormone levels are either subclinically low or overtly low because of the immune system, because that autoimmune response. And sometimes iodine can sometimes put fuel on the fire. So some people take it, they do well with it, and they say, oh yeah, I took iodine, I did great. But again, keep in mind, it could have the opposite effect. So I just would be, I would be cautious, about just, especially randomly just taking it on your own.
Yeah, I agree with you that it doesn't address the autoimmune component at all. The other thing, Dr. Isabella Wentz is not for iodine unless your TPO antibodies drop to, I think she says, below 100. I was going to say also Dr. Alan Christensen has just released a book called The Thyroid Reset Diet, right? And it's all about being low on iodine. And so it's kind of with a lot of research behind it. So, but I like your answer of just like how bioindividuality really plays a role in this. And if you couple this with like somebody who's got a lot of brain fog and lumpy breasts, for example, breast tissue, ovaries, and the brain, and apart from the thyroid, is actually have the biggest number of receptors for iodine. So like, for example, a lot of women just feel like their breast health improves when they take iodine. They're a lot sharper. They can think clear again, right? But it's, it's like with everything, is sometimes it's also the dose. In herbalism, we say the dose of an herb can make a difference between medicine and poison, right? And so I would defer to iodine as being one of those. That you have a deficiency, probably having a little bit helps bring your antibodies down, and then stop when it's when you've replenished and back off. But yeah, working with someone and just being monitored and advice on this is really, really important. When I was in private practice, I have worked with women who were put on high iodine doses and were in a very miserable state. And it took them a couple of months to get themselves out of it. So definitely a word of caution on this. Hey, you guys, we need to wrap up. I've got another call to jump on. I'm doing a podcast after this. So for those of you who haven't got your answers, and I can see there's more things coming up, do email us to our support team and we'll forward that to Dr. Eric. Or if you have time, just jump on our social media and just maybe answer those questions if you like this weekend, Dr. Eric. All right. Thanks, everyone. Thank you so much for being here, for making the time today. It was a very highly desired talk. I haven't talked about Hashimoto's and Graves in a while, so this was really good to connect with you on that and do a bit of a refresher.
Yeah, thanks. Thanks, Magdalena. Appreciate you having me.
Thank you, everybody, for your questions. I hope this is helpful. And again, naturalendoctrinesolutions.com. You can find a lot of answers to your questions. Great resources from Dr. Eric Zielinski. Osansky. All right. Thanks, everybody. Bye for now.